Hello and good evening, everyone. Am I audible? Well, due to heavy rains, there is some network issue here. You can put it in the chat box if I am audible. Okay, thank you, Dr. Geeta. Dr. Piyush, am I audible? I hope I am loud and clear. Okay. So, welcome to a new session on EDEN 2. So, today we'll be like every 2 weeks in EDEN 2, we'll be starting a new subject in our NEET MDS learning process. Okay. So since last week, we were learning like orthodontics. Okay. So let me tell you one thing clearly before the session. In this session, we are not going to discuss the previous year questions or the high yield questions or the multiple choice questions. Okay, we are not going to discuss that here. Okay, that will be conducted in a live session by an ortho faculty. Now, this session is just like a trailer of the movie. Okay, so what we are mainly going to deal with is how to tackle the subject of orthodontics, how we can approach this subject of orthodontics. That's what we are going to mainly learn today in this session. Okay, so we'll be mainly learning 4 things from this session. First, like what is the weightage of this ortho subject in the NEET MDS exams? Okay, what is the weightage of this orthodontic subjects in our NEET MDS exam? Then we will be looking at what are the previous trends of the questions that are asked in the orthodontics exam in the NEET MDS exams. Okay, like how many questions were asked in the previous years. Okay, then third thing, that is the major portion of this session, is like we'll be analyzing the questions together. Okay, we'll be looking at every questions that were asked in the ortho exam from the year 2017 till 2024. Okay, and then we'll be seeing like from which topic more questions were asked frequently. Okay, we'll be analyzing from which topic more questions were asked frequently so that you will get a general idea about which topic you should be focusing more on while studying. Okay, so that is very important. Just telling you blindly like, okay, these are the high yield topics, you can study these topics, just telling you blindly with a that doesn't make any point. So what we are going to do today is we are analyzing with you all the questions that were asked in the ortho from the year 2017 till 2024, and then we will see from which topic more questions were asked frequently. Okay, so that topic you should be focusing more on while studying for your NEET exam. Okay, then fourth thing, we are again we are going to analyze the how many image based questions and how many clinical or case based questions were asked in this ortho subjects. Okay, so let's begin, doctors. So orthodontics, it is a very interesting and important subject. Okay, so according to the National Board curriculum, you can expect a total of like 14 questions from this ortho subject in the NEET exam, NEET MDS exam. Okay, so if you look at the previous trend of the questions that were asked in ortho, you can see that by around the year 2017, a total of like 14 questions were asked, which decreased to around 12 questions in the year 2019. And by 2020 and 2021, again, 14 questions were asked. In 2022, around 15 questions were asked. And since last 2 years, around the same thing only, like 14 questions were asked from ortho. So you can expect anywhere between like 12 to 15 questions for this ortho subject in the NEET MDS examination. Now, next, we will look at all the questions from the year 2017 till 2024. Okay, so after analyzing all these questions, I will tell you here in this yellow color column, you have the main topics. Okay, and here you have the questions. Okay, in the left side you have the questions, and in the right side you have the topics. Okay, so we'll after analyzing one question, we will put it under one section under here. Okay, where it belongs to. Okay, then we will analyze from which topic in this right section, more questions were asked. Okay, we'll be analyzing that. Okay. So first one is a case-based questions. A 12-year-old boy presented to the orthodontic treatment and the orthodontic diagnosis for this patient. It comes under the occlusion and the classification of malocclusion under this category mainly. Next, we have the center of rotation for tipping, which comes under the topic of biomechanics. Next is mixed dentition analysis, Tanaga and Johnston, which comes under the topic of diagnosis. And next is an image-based question showing the bends in the archway, which bend it is. It also comes under the biomechanics of tooth movement. Next is after orthodontic correction, we were talking about the retention and relapse. Okay, this retention and relapse topic and the treatment planning topic, we will put it under a separate heading here called the miscellaneous. Okay, we'll put it under a separate heading called miscellaneous. So this relapse question, it will comes under the miscellaneous topic, and the wagon wheel effect in orthodontics, which comes under the biomechanics of tooth movement, and the first diagnostic setup, which comes under the diagnosis here, and the appliance used for the treatment of the this thing. It is a fixed tongue thrusting appliance, which will come under the preventive and interceptive orthodontics. All the habit breaking appliances will come under the topic of preventive and interceptive orthodontics. Next is for correction of the incisal liability. What the treatment plan? Okay, treatment plan and the retention and relapse, we will put it under the miscellaneous category here. So it will come under the miscellaneous category. Then next is a question on the identification of the instrument, that is the plier that is used. Okay, that we will put it under the removable and fixed appliances category. And what will be the effect of force if the diameter, that comes under the biomechanics topic, and the orthodontic study models. Okay, that will come under the diagnosis topic. Okay, now next is force acting on the tooth movement. Okay, which force is acting on the tooth movement? That will come under the biomechanics of tooth movement category. And the secondary displacement of age of maxilla comes under the growth and development. Again, next, that's all with the 2017 questions. Now let's move on to the 2018 questions. The bone, which shows the intramembranous growth, mandible, which comes under the growth and development category, and the implant method of studying growth is developed by whom? That also comes under the growth and development category. Now next is the stainless, the wire that is used for the appliance, which will comes under the removable and fixed appliance category. And the straight wire appliance, again, removable and fixed appliance category. Then cephalometric questions were there, like opistheon. What is opistheon is asked, which will comes under the category of cephalometry. And shear bone strength of orthodontic brackets, which will again come under the topic of the fixed appliance. Next is the anchorage. Okay, it is the question about anchorage, which will comes under the biomechanics. Then the soldering temperature for the orthodontic silver wire, which comes under the fixed appliance category. Then the common disadvantage of cervical pull headgear, again, comes under in the myofunctional and orthopedic appliances. And the lingually placed incisor, the treatment modality. Okay, the treatment modalities, we will put it under the miscellaneous category. Then the chin cap during transition period. Chin cap and all the other headgears and face masks and all the other things comes under the myofunctional and orthopedic appliances category. And the brain development, according to the Scammons growth curve, okay, it comes under the growth and development category. And the growth of mandible after eruption of the first molar, again, comes under the growth and development. And the orthodontic tooth movement affected by comes under the biomechanics topic. Now, Frankel regulator, again, a myofunctional and orthopedic appliance. The spring, that this is the calculation-based questions you can expect in the ortho. Okay, like the spring is activated by this 3 mm, it produces this much force. Then the load deflection, what will be the load deflection? Like that calculation-based questions can also be asked in ortho. So this can come under the biomechanics. Then the Bolton's ratio. Bolton's ratio comes under the category of diagnosis. And to take advantage of growth, orthodontic treatment should be started during. Okay, that comes under the development of dentition. Okay. Next, again, an identification of the instrument. It is a debonding plier, which comes under the fixed appliance category. Width analysis, again, diagnosis category. The arch wire that is used to treat the posterior crossbite, which comes under the miscellaneous category. And the CATS classification, which tooth is used in CATS classification, that comes under the occlusion and the classification of malocclusion. Okay. Now next is in fixed orthodontics, the bracket, how will the bracket produce a movement? Okay, that will comes under the fixed appliance category. The decreased SNA is present due to, again, cephalometry. And next is a clinical based question where a 10-year-old boy with SNA and SNB is given and what type of appliance is used. Okay, that will comes under the myofunctional and orthopedic appliances. And again, a clinical based question, an 8-year-old girl with 2 mm midline diastema and high frenal attachment, what is the treatment plan? That will come under the miscellaneous section. All the treatment planning and the retention and relapse category, we are all putting it under the miscellaneous category. Next, again, a clinical based question, an 8-year-old child having crowding and no physiological planning. What is the treatment plan? Since the answer is serial extraction, we are putting it under the preventive and interceptive orthodontics. Okay, all the space gaining methods, serial extractions, and the space regainer, space maintenance, all those topics comes under the preventive and interceptive orthodontics. Next is Delta class, again, removable and fixed appliances. Type of anchorage comes under biomechanics. Order of bends shown in the picture, which is again coming under the biomechanics topic. Again, lot of like image-based questions of identifying the appliance. This is a common favorite question in the ortho exams, and appliance will be given and you will be asked to identify. Okay, like that. An instrument can also be given and you are asked to identify. Okay, that is like the one of the most favorite questions of examiners in the ortho exam. Okay, first is a Frankel 3 appliance, comes under the myofunctional and orthopedic appliance. Then we have the Herbst appliance, again, myofunctional and orthopedic appliance. And the palatal lift processes comes under the removable and fixed appliances. And classify the malocclusion, which comes under the topic of classification of malocclusion. Next is the case-based question. A 9-year-old patient with class 2 and mandibular prognathism, what will be the treatment plan? It is a functional appliance. Since it is a treatment plan they are asking, we are putting it under the miscellaneous category. Maxillary deficiency with anterior crossbite, how will we treat it? Okay, that again, we are putting it under the myofunctional category. Dewey's malocclusion, types of Dewey's malocclusion that is seen in the this thing. Other than angles, you should also be knowing about the other malocclusions also, like Dewey's and all the other malocclusions also, you should have an idea about it. Okay, that we will be putting it under the classification of malocclusion. And the line passing from the condyle to lateral surface of ramus, which comes under the cephalometry category. Next is after maxillary lateral rotation surgery, how is it corrected and seen in which plane? Okay, that comes under the biomechanics. And intermaxillary elastics are given in, that comes under the removable and fixed appliances. Aesthetic brackets are made up of, again, removable and fixed appliances, and identify the appliance shown in the picture. Okay, that comes under the myofunctional orthopedic appliance. Okay, next, rectangular wire is used for, comes under the biomechanics. Which of the following is not a fixed space regainer? All the fixed space regainers and space maintainers, all those comes under the preventive and interceptive orthodontics. Then the type of resorption seen when light continuous orthodontic force are applied. Again, biomechanics. Most commonly used width for rectangular wire. Again, comes under the topic of biomechanics. The highest critical surface tension of the orthodontic brackets is given by, again, biomechanics. Arrange the following wires regarding to the coefficient of friction from the highest to a lowest, which comes under the removable and fixed appliances. And with the patients from the nickel allergy, which of the following type of orthodontic brackets can be used for those patients with nickel allergy? Again, coming to the removable and the fixed appliance. And the SND is seen in which analysis? Steiner's analysis, which comes under the category of cephalometry. Then in McNamara analysis, again, comes under the topic of cephalometry. Then assertion reason questions are like previously asked in a lot of papers, but now we can rarely see such type of assertion and reason type of questions are now rarely asked. Okay. So one assertion reason type question was asked in the year 2021, and it comes under the myofunctional and orthopedic section. And again, cephalometric tracing is there, which comes under the category of cephalometry. Again, the identification with the image is there, which comes under biomechanics. A 4 mm diastema was closed with the help of fixed appliance. Again, retainer and relapse. Retention and relapse question was asked, which is included under the miscellaneous section. Then the appliance is asked to identify, which again comes under the removable and fixed appliances. And here they have given a face mask image and asked to identify the appliance, like how many hours the appliance should be worn. Okay, it belongs under the myofunctional and orthopedic appliance category. Next, what are the correction, the elastics that are used for correction? Okay, that will be that we can put under the removable and fixed appliances category. And the image showing tooth movement. Again, there is like calculation based questions you can expect in the ortho. The image showing a tooth movement. Force is 120 gram and distance of 10 millimeter is moved. So what is the moment of couple here? All those calculation based questions can also be expected in ortho, so that it can be put under the biomechanics of tooth movement and branch of orthodontics. Okay, that can be that we can put it under the miscellaneous section here. Okay, then we have the single tooth gross bite in upper anterior region without a recurrent. The treatment, what is the treatment? That we can put it under the removable and fixed appliances here. Then the which type of the smile arc is there? It is like consonant, and the time of completion of the nasal bone formation comes under the growth and development. Identify the CVMI stage, that is cervical vertebra maturation index. Okay, this is the CVMI stage, cervical vertebra maturation index stage. Okay, that is type of to analyze the growth pattern of an individual. Okay, so that can come under the growth and development category. And the line joining the soft tissue poggia to the S-shaped curve, again cephalometry. Next is the bones of the cranial, how it ossifies, comes under growth and development. Force applied by removable functional appliance, it comes under the biomechanics. Then two clinical based questions were asked, like 9-year-old patient with skeletal class 2, what will be the treatment? Okay, that we can put it under the myofunctional and orthopedic appliance. And again, long face, open bite, and child is in growing stage, what will be the treatment? We can put it under the myofunctional and orthopedic appliances. Okay, next is light force is delivered in which wire? Okay, we can put it under the biomechanics category. The tooth movement that is used, application of pressure on the periodontal tissue. Okay, biomechanics category. Then which growth site is not active in mandible? Comes under the heading of growth and development. And duration of post-lag phase during orthodontic movement persists for like how many days? Again, comes under the biomechanics of tooth movement. Next is again a cephalometric analysis. Which analysis comes under the heading of cephalometry. In pre-adjusted edgewise bracket or slot size comes under fixed appliance. Cat's classification of premolar comes under classification of malocclusion. The gauge wire that is used to make the fitted labial bone. Okay, that comes under the removable appliances. The anatomic portion of the study model again comes under the diagnosis. The cephalometric analysis, cephalometry category here, twin block appliance, myofunctional category here, and identify the given appliance, the removable and fixed appliance category. Okay, so this appliance is used for mainly, okay, it comes under the mainly the since it is a habit breaking appliance, we are putting it under the preventive and interceptive orthodontics. And the least stable in the orthodontics, it is widening of maxilla. And the cephalometry, again, craniometric soft tissue landmark from the tip of the nose to the most prominent point on the chin. Okay, what does line called? Belongs to the cephalometry. Tip back bends are called second order bends, which also comes under the biomechanics of tooth movement. The correction of the can be achieved by which growth curve? Why we'll be able to do it in the mandible but not the maxilla, they are asking. So it comes under the growth and development. Then we have a clinical based question where the correction of the condition of the anterior crossbite, okay, which comes under the removable and fixed appliance. Lingual orthodontic appliance question was asked, comes again under the removable and fixed appliance. Then the freeway space is increased in which condition? Comes under the occlusion and classification of malocclusion. Okay. Then there is an image-based question was asked, why the crossbite is seen here. Okay. So that can be included under the etiology of malocclusion. And again, a clinical based question, a 2-year-old child, like what will be the treatment plan? Okay, we are putting that under the miscellaneous category. And again, what is the reason for the relapse of the teeth? Okay, which gingival fibers are responsible for the relapse of the teeth? We are again putting in the retention and relapse category under the miscellaneous section here. Then temporary anchorage devices, which is the true statement. We are putting it under the biomechanics and the anthropometric measurement for the assessing the growth of an individual. We'll be putting it under the growth and development and the envelope of discrepancy in the orthodontic. Again, putting it under the biomechanics category. The last one is also a clinical based question. Two girls of 11 years came to an orthodontist. The first one has attained menarche while the other one has not. Which one is an ideal candidate for functional appliance therapy? Okay, it's mainly based upon the growth and development stages of the girls. So we are putting it under the growth and development category here. So after analyzing 110 questions, okay, from the year 2017 till 2024, we can now say that biomechanics of the tooth movement. Okay, that is the favorite topic of the examiners in the NEET MDS exam from the ortho subject. Okay, this is the main topic that you should be focusing more on while studying. Okay, it is the biomechanics of tooth movement. Then comes the removable and fixed appliances. All the removable and fixed appliances that you are studying in the textbook, you should be able to identify the appliances also, because image-based questions are like more asked from this removable and fixed appliances. Like they will give an image and they will ask you to identify which is the appliance that is shown here. And they will also give the instruments like the debonding pliers or other universal plier. Such images they can give and they will again ask you to identify which is the instrument here. Okay, so the first one you should mainly focusing on is the biomechanics of tooth movement. Then you should focus on the removable and fixed appliances. Then next is the myofunctional and orthopedic appliances. The headgears, the image-based questions with headgears, face mask, and the chin cup and all that, those all are like favorite questions of examiners. So you should be focusing more on the myofunctional and orthopedic appliances also. Okay, I'm not telling that you can skip the other topics. You should also focus on the other topics, but these three topics you should please give more time while studying. Okay, and please study these three topics thoroughly. Okay, because more questions were asked from these topics repeatedly. Okay, so I hope you guys understood the main topics. Any questions, doctors? Any questions? Dr. Geeta, Dr. Navya, Dr. Piyush? Any doubts or any questions? Today we are not discussing any multiple choice questions here. Okay, we'll not be discussing the multiple choice questions here. That will be done in a live class by one of our ortho faculties. Okay, this is just like for which topic you should be focusing more on. That's the only thing that I am telling here today. Okay. Yeah, Dr. Geeta, are you suggesting that we discuss the questions or which topics from these high yield topics you are asking? Like if the biomechanics of the tooth movement is the most common topic, then you are asking from the biomechanics, which is the topic that okay, okay, Dr. Gita, I understood. Okay, so like in growth and development, the all the yes. Likewise, each chapter. Okay. So there are some specific topics in the growth and development, all those things. Mostly recently in the last 2024 exam, even from this growth and development topic, they were asking like clinical based questions like this. Okay, like the last question that we discussed, like two girls were there, one has attained menage whereas the other has not, like that. Clinical based questions were also asking from the growth and development instead of the normal straightforward questions. Okay, so you should be mainly focusing on the this Schemann's growth curve, this cephalocaudal growth, and the other these things. Okay, like what happens during in the puberty of for the boys and girls, like that. All you should be focusing on. Then coming to the development of dentition, you should be focusing mainly about the transient malocclusions. Okay, like the ugly duckling stage and all the other transient malocclusions, you should be focusing on it. But development of dentition is not a favorite topic, I think, because not much questions were asked from that. Then coming to the etiology of malocclusion, all the habits, okay, thumb sucking and the mouth breathing and the tongue thrusting, all the habits. Along with the habits, you study the treatment plan also. Okay, like what are the treatment options given for each habit? Okay, that also you should study along with the while studying the habits. And these topics, okay, this thumb sucking, tongue thrusting, and all the other habits are overlapping topics with the pedodontics. Okay, so while covering these topics, you can study the pedo those topics also. So in a whole, you can cover a major portion. Okay, that will be very helpful for you to remember, and you can cover the topics easily also. So I'll suggest that while studying this etiology of malocclusion in this ortho, you cover the topics of the pedo also. Okay, so that will be very helpful for you. Cephalometry, it is an exclusive topic in ortho. You have to study it separately itself. Mainly the all the cephalometric points. Okay, sometimes they can give a this thing like an cephalometric cephalograph, and they will ask you to identify the point from there. Okay, if all those are given and they identify the plane also. Okay, so if that are given, cephalometry you should be focusing more on, because it is an exclusive topic on ortho also. Then diagnosis, I think you'll be mainly be able to diagnose the angles class 1, class 2, and class 3, like that. From the image itself, you'll be able to classify itself. Then classification of malocclusion, other classifications other than these angles. Okay, there is Dewey's, Katz, premolar classification, and all those things that you should be focusing on. Biomechanics, again, sometimes the calculation based questions can also be asked, so you should be knowing the formulas also. Then learn about the movements of the tooth, like tipping torque and body movement, and all those things you should be focusing. Then the preventive and interceptive orthodontics, not much questions were asked, but still, again, while learning about the etiology of malocclusion, learn about this too. Okay, because these like habit breaking appliances, okay, they mainly come under this preventive and interceptive orthodontics, like the thumb cap and the tongue grip and the mouth guard, and all those things comes under the preventive and interceptive orthodontics also. It will help you in while studying the pedo also. Okay, removable and fixed appliances, very important. We have the clasps, all the different types of clasps are there, and all the removable appliances itself, a lot of categories are there. And the fixed appliances, which wire is used, what is the diameter of the wire, what is the diameter of the brackets that we use, the elastics that we use. Okay, all those things. And the instrumentations, instruments are very important. Mainly they had only asked like debonding plier and the universal plier or something. So like you should be thorough with the instruments that you use in ortho also. Then you have the myofunctional and orthopedic appliances. Recently this myofunctional and orthopedic appliances were asked more. Okay, like the headgears and the face mask, they will give you an image and ask you to like analyze, ask you to find out like which is the headgear that is given or the face mask that is given. They can ask you to analyze that also. Miscellaneous about the mainly the treatment planning. Okay, you while studying the disease itself, you should study about the treatment planning also. Okay, so that all those chapters will be covered equally and in a broad base. Okay, so while studying about the disease, study about the treatment planning also. Like while you are studying about the class 1 malocclusion or class 2 malocclusion, then look for what is the treatment options for that also. While when you are studying about the crossbite, then look for what is the treatment option for that also. Okay, that will help you to cover a large topic very easy. Okay, then concentrate on image based questions and the clinical based questions. Okay, because recently more and more image based questions were asking, and in the last exam also, in the 2024 exam also, there were like minimum of 2 image based questions from every subject. Okay, every subject a minimum of 2 image based questions were asked. So while you are studying itself, take a standard textbook and just flip through the textbook. Okay, and whenever you see an image, just look at the image and read the subheading under the image. Okay, and do it for 1 or 2 times, and when the third time comes, what you can do is just hide the subheading and try to identify the image. Okay, that will try to help you in identifying this tackling these image based questions very easy. Okay, any other doubts, doctors? Dr. Geeta, did I make myself clear? Dr. Navya, Dr. Piyush, any other questions? Any other doubts? Okay. Okay. If you have any other doubts, you can ask me. Okay. Now, I hope I had my I hope I had made myself clear. Now, let me tell you some of the important features of our app. Okay, so this Eden2 app you can download from the Play Store or App Store, and after logging in, you can see a login screen like this, and there underneath you have something called as course. Okay, in the course list, you will be able to see every subject here. Okay, ortho also there will be here. And in the orthodontics, you can see that there are videos, notes, and tests is also there. Okay. First, you can watch the videos. Okay. All the recorded videos will be there, and all these live class videos will also be there in the app. Okay. So first you can see the video, then you can go through all the notes, and then for analyzing, you do the test. Okay. So after doing the test, you will get a like a general image of like where you stand. Okay, how much knowledge you have, you will get a general idea also. So in the orthodontics topic itself, you have every topic like the growth and development of dentition, etiology, whatever the topics I had, main topics that I had given here, all those topics will be given, and all under all those topics there will be video class, notes, and exercise also separately. Okay, so you can do that, and it will be very useful for you during the NEET exam. Next, we are like studying ortho for the past 2 weeks. Like this, or since ortho is a main subject and a very high yielding subject, we have started from the 8th July, and it will be there till we'll be studying till the 20th July. And there are like 5 live classes where our experienced ortho faculty will be taking live classes, and from 2 topics only. Okay, from it will be divided, not the whole ortho will be covered in one class. It will be divided, like the growth and development of dentition will be taken in one class, then the malocclusion cephalometry in another class. Like that, it will be divided. So if you have any doubts, you can ask the ortho staff directly itself. And at the end of every week, there will be a subject test and there will be a grand test also. Then before completing the subject, we will have a cumulative test also. Okay, so these tests are very important. Okay, these tests are very important for time management actually. Like in the 2025 exam, you will be mainly getting time bound sections. Okay, like the whole NEET exam will be divided into 5 categories, and you will only have 42 minutes to answer 40 questions in each section. Okay, So time management is critical in the NEET exam from the next year onwards. Okay. So this continuously doing this test will help you in managing the time management. Sure, Dr. Piyush. Sure, sure. Okay, the high yield topics. Okay, the what I had mentioned here is also the high yield topics. You can take a photograph of the this thing if you want to, slide if you want to. Uh, Dr. Piyush, if you want, you can take a photograph of this. Okay, okay, okay. Then I'll ask her to forward it in the group. Okay, okay, doctor. Any other doubts, doctor? Dr. Geeta, Dr. Nabia, Dr. Piyush, any other doubts? Okay, okay. Thank you, Dr. Piyush. So thank you so much for attending the session. I wish you all good luck and all the best for your future. Thank you. Thank you so much and good night. Thank you, Dr. Piyush.